apparently they did a whole update on the BeLive website where I normally do my videos. So this is exactly why we had to reschedule and restart a whole new video with Dr. Gary Richter. Dr. Gary Richter is a holistic integrative veterinarian out of Oakland, California at his hospital, Holistic Veterinary Care, again in Oakland, California. Dr. Richter, thank you so much for joining us today. Yeah. How are you?
My pleasure. Thrilled to be here. Thank you.
I am so sorry you had to wait a few extra minutes for technology to figure itself out.
No worries at all.
Never a dull moment. But we are super excited to have you because we're going to be talking today about one of my very favorite topics. As you can see, I have a marijuana leaf on my finger. So diving into the world of medical cannabis for our animals, a lot of people straight off the bat are very familiar and they hear a ton about CBD. Yeah. Now, as we know, CBD is typically derived, if it's sold over the counter in a pet shop or somewhere else, from hemp. Mm-hmm. So the confusion between hemp and medical cannabis, what is that main difference?
So realistically speaking, there's two differences. There's a kind of a real world actual physical difference, and then there's the legal delineation. But in the real world sense, it's all the same plant per se. So it all comes from the plant that's called Cannabis sativa L. Whether it's hemp, it's marijuana, it's cannabis, whatever you call it. The difference is that plants that are defined as hemp legally produce less than 0.3% THC as part of the plant. So if it's a cannabis plant that produces less than 0.3% THC, it is called hemp. If it's anything greater than 0.3%, then it is called, legally speaking, they would call it marijuana. In the medical community, we just tend to call it cannabis. But that's really the difference. So realistically speaking, the main difference is how much THC is in the plant.
Mm-hmm. Now, directly straight off the bat, too, we have to deal with concerns surrounding the amounts of THC that's found in a product. Static ataxia, as you know, as a veterinarian, is a very real thing.
Yes.
Do you see that happen with hemp-based products? Because I've heard a few stories of people coming across a product that they bought at a pet shop that has triggered this response in their animal.
So the answer to your question should be no, in the sense that no amount of CBD is going to cause static ataxia or the symptoms that are associated with a THC overdose. Sometimes you might see a little bit of sedation, but really even not that profound on that side of things. I have heard stories about hemp products that actually turn out to have more THC in them than people thought or was analyzed. So maybe that's where some of those reports are coming from, is perhaps people bought something over the counter that really had more THC in it than was realized. But generally speaking, even when it comes to cannabis, when we as veterinarians see dogs that have THC toxicity or static ataxia, almost always that is because the dog got into something they weren't supposed to. They got into the owner's edibles, the owner's stash. It is exceedingly rare that something like that would happen from a medical use of cannabis in a dog, and even more so if that's being done under appropriate veterinary supervision.
Mm-hmm. Now, as a veterinarian, do you have any concerns with the amount of hemp-based CBD someone would give their animal? Like, is it a danger if, let's say, the animal, for some reason, drank the entire tincture of hemp? Is there any concern in regards to liver enzyme elevation or anything that you've seen?
Yeah, CBD is an extremely safe molecule. The toxicology studies that have been done in dogs have shown it to be extremely safe, even at very, very high doses. Some of the research that we have shown if the dog is given very high doses over a period of time, like days or weeks, you can sometimes see liver enzyme elevations, but that will revert back to normal once they're off of it. But, to take your example, if the dog just ate the entire bottle of CBD just in the one-shot dose, nothing's going to happen to that dog at all. They're going to be just fine.
Right. Now, typically, when we talk about toxicity to anything really, there's immediate symptoms that we can start to see. Do you believe that THC is the culprit of the sometimes fatal outcome, or do you think it's a secondary thing that's happened that has caused the death?
So and I'll preface this by saying that deaths from in animals and in people for that matter, but deaths in animals related to THC ingestion are extremely rare. And when they do happen, yes, THC plays a role, but at the end of the day, it's sort of a secondary effect. So, for example, the one dog that I've seen that actually passed away from a THC overdose, what happened is the dog got so much THC that it was basically unconscious for 36 hours, and the dog, while unconscious, vomited and aspirated the vomit into its lungs and then wound up dying from that. So, technically speaking, that dog did not die from THC toxicity, although clearly it was the THC that got that ball rolling.
Yeah. If a veterinarian were to recommend a hemp-based CBD product, or even if they were to use it for themselves, for their own animals, what are things that you look for in a specific product that you'd say, yep, that's totally safe for an animal?
Yeah. So, I think that if we're talking about like an over-the-counter product, so something that's not purchased in a cannabis dispensary, so all of those products are going to be hemp-based. At that point, the first thing that you need to look at is the quality of the product. So, this is true for the entire sort of vitamin, supplement, nutraceutical sort of space, but particularly true when it comes to CBD right now, because CBD is so popular and so trendy. There's companies and labels coming out every day, and not all of them are reputable companies. Some people are out there just to make money, and it very well may be that the products that people buy do not actually have in them what it says on the label. Words of wisdom in that regards are always buy from a reputable company, a company that either you've heard of or one that's been recommended to you by somebody who's familiar with that space. In addition to that, you can ask the company to provide you with what's called a COA, or a certificate of analysis, and that will show you the scientific analysis of the product that you're actually buying, so you can really see what's in it and what's not in it. And then lastly, my recommendation for people, if you're looking at a CBD product to buy for your dog, my preference is to get the liquid preparations like an oil. And I say that because they're much easier to modulate the dose. It's very easy to give a little bit more, a little bit less if you're giving a liquid, whereas if you're giving like a treat, it becomes a much less precise sort of thing. Mm-hmm. So for me, from a therapeutic use standpoint, I think the liquids work better.
And with that too, with the therapeutic outlook, do you see better absorption through all the mucosal membranes, or do you see better through digestion if they were eat a treat? Like, is there a difference?
Yeah, it's a good question. And the supposition is that you're going to get better absorption transmucosally, meaning if you give them the liquid just directly in their mouth. Now, obviously, like as a person, the instructions would be hold that under your tongue. Clearly, that's a non-starter for a dog.
Hold it.
Exactly. But really, the hope is that you're going to get some direct absorption into the bloodstream through the tissues of the mouth before it gets swallowed and then ultimately digested and absorbed. Now, just to be clear, we don't have comparative analyses of, say, transmucosal absorption versus gastrointestinal absorption in dogs. So that's just, it's a supposition based on what we know happens in people. Mm-hmm. But it makes sense. It's probably true.
Yeah. Now, Dr. Gary Richter, I'm very lucky in my area to be surrounded by a lot of integrative, holistic-minded veterinarians who know a lot about medical cannabis, CBD. They know a little bit more than the average conventional veterinarian. If someone were to go to their clinic and say, hey, vet, can you instruct me and guide me through the use of a CBD product or cannabis product? What if that vet doesn't know anything? How can we educate the vet? Are there any resources where they could learn to better advise the use, or are they just left high and dry, the person?
Well, I mean, the short answer to your question is yes, there are resources out there. Both myself and quite a number of other veterinary professionals have put out continuing education courses for veterinarians, as well as some for pet owners to learn. What I will say at this point is number one, the relative legality of what a veterinarian can or can't say is really variable from one state to the next. So it may be that your veterinarian, depending on where you live, is legally not allowed to talk to you about this kind of stuff. So that just depends on where you live. But because cannabis is relatively new in veterinary medicine, this kind of information is stuff that veterinarians need to sort of actively seek out. In my experience, every veterinarian that I talk to is very eager to learn, partially for personal reasons and partially because we all have people coming into our offices every day with questions. And no veterinarian wants to not have the answers to these questions.
Right. Speaking of legality, I know you're in California, and there's a Assembly Bill 2215.
Yes.
Is there any update on that for veterinarians in California, or is it still at that same?
Sure. Well, there's a couple of updates actually. So 2215 passed last year in 2018. So the Veterinary Medical Board was given until January 1st this coming, so January 1st, 2020, to come up with published guidelines as far as so effectively AB 2215 stated that veterinarians can, quote, discuss the use of cannabis with pet owners. It very specifically avoided the term recommend, which is what physicians are able to do in California. So the board just literally in the past week or so came out with their guidelines that were due, in just about a month. To make a long story short, they either intentionally or unintentionally wrote the guidelines extremely vague. So they didn't give us an enormous amount of guidelines, but they also didn't give us an enormous amount of boundaries, which, for me as a veterinarian is a good thing. Because I don't want the Veterinary Medical Board telling me what I can and can't say, as long as it's within the bounds of good medicine. And then just one more thing on the legislative side, there's another bill called it's Senate Bill SB 627. That is actually being considered by the legislature right now. SB 627 would actually allow veterinarians to recommend cannabis, which would basically put us on the same playing field that physicians have been in California since 1996.
Yeah, it's amazing how long it's actually been available for human physicians to recommend it.
Right,
right. We forget about that it's been around since 1996.
I know, it's well over 20 years now.
And the only reason why veterinarians are not, because they were left out of that whole thing.
Nobody thought about it at the time.
Right. And then here we are today. Amazing. So here's a question that I'm often asked. Is there a certain amount of THC that someone would have to give if we're treating cancer or treating a more impactful autoimmune disease?
Sure. So, if we're talking about very aggressive or very painful disease conditions, so severe pain, cancer pain, that sort of thing, or as you say, autoimmune disease, some kind of really severe inflammation, when we look at, some of the data that's out there in human medicine, that's when we're really looking at some of these higher THC formulations that are used. Now, again, from a research perspective, we don't have this kind of information in veterinary medicine yet. It will come, but we don't have it yet. However, just based on what I have seen happen in patients and what we can extrapolate from the human data, you do wind up having to put these guys on fairly high doses of THC in order to get these, pain relieving effects. Say, for example, if a dog has a bone tumor, which is an extremely painful condition. So the key whenever we're looking at, a dog or even a cat that needs to be on a higher level of THC, you can't give them the full dose on day one.
Right.
Giving a dog that full dose of THC on day one is going to be, it's a lot like a person who ingests a whole bunch of THC that's not used to that. It's not, like many of us have, it's not going to go well. this is when dogs wind up in the emergency room.
Mm.
So the way that this works is just like with people, dogs will develop a tolerance to the psychoactive effects of THC over time. So if you start them off at a low dose and you incrementally increase every few days or once a week, they're building up a tolerance to the psychoactivity, but they're still getting the medical benefits. So for example, I had a patient once where the dog had a bone tumor, and the owner was treating the dog with a THC dominant compound. And at one point, that dog was on, I think the dog was on 100 or 150 or 200 milligrams of THC twice a day. If you're not familiar with those kinds of numbers, that would put me under the table for a while.
I was going to say, oh my God.
Yeah, it's an obscene amount of THC, but because the dog slowly worked up to it, she was walking around like there was absolutely nothing wrong with her at all. She was just peachy keen and happy. But like I say, you just can't do that all on day one.
Yeah, that's a lot. Wow.
It is.
Myself as a medical marijuana patient here in Jersey, and I take like 5 milligrams per dose.
Yeah.
If you want to compare,
that's a much more sane number.
Yeah. Oh my goodness. Wow. So what is the one thing, I know this is probably the hardest question to ask and answer, but one thing that you see like most commonly healed with using medical cannabis, what's the one disease process that you see success with almost every single time? Is there or isn't there?
Well, like anything else, cannabis is not going to fix, it's not going to fix everything.
Yeah.
But that said, some of the things that we see it be really profoundly effective for, probably the two things that immediately come to mind are pain, particularly arthritis related pain. Dogs respond really well. And then, while again, not every patient, but seizures. Seizures can respond very well, particularly to CBD, although certainly other cannabinoids, THC as well, can be beneficial there. And again, dogs have seizures for a lot of different reasons, so it's not going to work for every dog. But we have seen quite a few dogs have a significant reduction in their seizure frequency after they've started cannabis.
And regarding the type of seizure, do you see one more successful than another being?
Not so much. Most of the dogs that are being treated for seizures are epileptics, but epilepsy is it's kind of a vague disease in the sense that, all epilepsy really means is that they don't have anything else demonstrable going on. They don't have a brain tumor, they don't have a malformation, etc. So, there's a lot of different sort of mechanisms and stimuli that can make these animals have seizures. So again, it's not only is it variable from animal to animal, but also you may have one particular formulation that works well in one patient and a completely different formulation that works well in another.
Yes.
It's very individualized medicine.
Mm-hmm. A brief breakdown maybe you can give us of what is the endocannabinoid system? Because I know most of the activity goes on within the cerebellum of an animal. Is that correct?
True.
But then, what other branches in the body where are those endocannabinoids found?
Sure. So to make an extremely complicated issue somewhat more condensed, the endocannabinoid system is a system of neurotransmitters that are present throughout the body, both in the central nervous system, the brain, and the spinal cord, as well as the peripheral nerves, the organs, the gastrointestinal tract, your skin. Receptors for the endocannabinoid system are everywhere. And effectively, what the endocannabinoid system is designed and evolved to do is maintain a process in the body called homeostasis. So homeostasis effectively is your body's sort of leveling mechanism. So think about it like a horizon indicator on an airplane. Your body is always trying to maintain that level horizon. So when there's physical stress, like an injury or an illness, or emotional stress, any kind of, bad day, what have you, all that stuff can throw things off. We all know from personal experience that stress can affect you physically. I don't know anybody who has not had some experience related to that. So And what the endocannabinoid system does is help the body balance things out and sort of maintain its equilibrium. And because the endocannabinoid system is involved with nearly every tissue in the body, that is why you wind up with this situation where there are so many conditions that cannabis can potentially benefit. Because whether it's a heart thing, it's a GI thing, it's a liver thing, it's a brain thing, there are endocannabinoid receptors there, and thus there is the potential for cannabis to have benefit.
And isn't it amazing that it's Mother Nature's gift to us that's just grown naturally like that? It's cool.
It is, and I think it's a classic example of coevolution, of people evolving in conjunction with nature.
Amazing.
That's not an accident that this happened.
Yeah, that's awesome. You mentioned the word formulation. Now, as we know, there's thousands of companies now that are producing these CBD products, and
sure,
most of them are getting them from the same place. But do you see anything that could be potentially dangerous that's mixed into these formulations, like essential oils, like herbs, like the carrier oils? Are there some that you prefer versus another, like krill oil I've seen?
Yeah, that's a good question. I mean, there's a lot of variability out there. I mean, just to speak to like carrier oils. So certainly there are people that are using like krill oil or fish oil. Other ones are using coconut oil or almond oil or hemp oil. There's not, absolutely speaking, a right or a wrong answer here. The one thing that I would say is that, all oils are fat. And if you're giving an excessive amount of fat to a dog, you potentially can cause GI upset. So I'm preferable towards products that are a little bit on the more concentrated side. So when you give the dose, it's just a smaller amount of oil that you're giving. Mm-hmm. So that's one thing. And then as far as sort of other ingredients, I mean, sky's the limit, both good and bad, from the standpoint of non-cannabis ingredients that people are putting in here. So, other herbs, those could be beneficial, but I mean, herbs are not by definition completely benign substances. Yeah. Herbs can potentially cause problems. You asked about essential oils. There are essential oils are terpenes that naturally occur in cannabis, but there are people that are adding additional essential oils to these products. Again, that can be beneficial, but there is such a thing as toxicity with certain essential oils. So again, not completely benign substances. So again, it's very much a buyer beware kind of market, and people really need to be aware of what they're buying before they start using it. And just one last point, it is not necessarily a true statement that if a product is good for a dog, it's okay to give to a cat. Cats are a lot more sensitive to certain things, essential oils in particular. So, I mean, as a professor of mine used to be fond of saying, cats are not small dogs. Right. So we have to think of them as a separate physiology. Yeah.
Yeah. Yeah. No, I have this conversation with Dr. Melissa Shelton frequently.
Sure. Oh, she would know.
Cats are just cats. They're not dogs.
Yeah.
They're
not small dogs.
Yeah. No. That's amazing. All right. So is there actually, I loved that you kind of repeated what I just learned from you yesterday as I took your course, My Pet Thrives, the Ultimate Pet Healthcare 101, which you guys have seen me post a few times here on the page already.
Yes.
And it's correct. Like we have to, if we're unsure about something, have that open conversation with your veterinarian. And if they don't know, maybe seek the help of a more integrative practitioner. You can find it at atriuma.org, as this whole page is very well aware of. But the answers are out there, and don't be afraid to have conversations, because these conversations are so very crucial, because we don't want to do harm to our animals at the end of the day. So, Dr. Richter, that was a tremendous amount of amazing information for everyone to hear from you. I consider you one of the very top veterinarians when it comes to medical cannabis use and CBD use with our companion animals.
Thank you.
Is there anything that you want to add that I haven't discussed? You talk about every day with your clients.
Gosh, I mean, I think that if I'm going to add anything, and I think we've really kind of covered it, but again, I mean, whenever we're talking about natural medicine, you have to be an educated consumer. And I know that there's a lot of people out there that do not have a holistic or integrative veterinarian sort of, within reach of them. And that means that unfortunately, the burden falls on you as the pet owner. So, I would urge people when they seek out information to make sure that they're getting information from a reputable source. I mean, we all know that the internet is the purveyor of all things good and all things bad out there. So clearly, I mean, don't buy anything, just because you read about it online. Certainly, any place where there's content online where that website is selling a product, sort of take that information with a grain of salt. It's not to say that it's not true, but if they have a vested interest, it may be slightly skewed. So, I mean, just be an educated consumer, do your due diligence, because it will absolutely, keep your pet safe. And I mean, that's why we started the My Pet Thrives website, in order for people to be able to kind of start to get information that's not attached to sort of selling a product or something to that effect.
No, that's true, because there's courses that I've taken where it's like, okay, now go buy this product because we just talked about it. I'm like, no, wait, I just want the information. I don't want the product.
Right. Exactly.
So if people are more interested in My Pet Thrives, they go to sign up. I know, but
yeah, all you have to do is just go to joinmypetthrives.com. And it's free. There's all kinds of really great content on there. Hopefully stuff you'll find useful, informative, to help you with your pet. But joinmypetthrives.com. And I'm putting that information out there for people, because I know that there's people out there that really want it and need it.
So many people. It's unbelievable. I'm fascinated too. It's sometimes when I watch the numbers on this little holistic page that I grew just build and build and build, and I realize there are so many people that want more answers than what they're doing. So hats off to you for creating that platform, because it's just amazing. And I do encourage all of you to also purchase the I think it's $47 program, like no expense at all, and you learn a tremendous amount about everything we've talked about and more. So worth it. When we look at the future of your program, what do we have to look forward to?
Gosh, I mean, there's so much in the planning stages right now that we're looking to bring out. But I mean, realistically speaking, my goal of My Pet Thrives is to sort of answer the question of what scientifically valid and accurate information can I put out there that's going to help pet owners take better care of their pets. Mm-hmm. So whether or not it's nutrition, or it's herbal therapy, or even questions and discussions about Western medicine, vaccinations, for example. These are all questions a lot of people have, and some people are willing to have that conversation with their veterinarian. Some aren't. Quite frankly, some veterinarians may or may not be willing to have that conversation. So you can just keep an eye out for more and more content to give you that kind of information that you need to keep your pet happy and healthy for as long as you can.
Yeah, cool. And one more thing you did mention that I completely forgot to bring up. You said you mentioned a course that you put together for veterinarians and pet parents to learn more about medical cannabis. Is this program, or was that a separate?
There's been a number of them. The ones that were there's a couple that are available for veterinarians specifically. The one that's still out there and available is being hosted by a group called the College of Integrative Veterinary Therapies.
Yeah.
And it's a 4-hour continuing education course for veterinarians. Probably a fair bit more detail than your average pet owner would be interested in. And then
I have to figure out how to access that myself.
And then, as far as pet owner related information, I don't know that we have anything that is actively posted right now, but that absolutely will be to come on My Pet Thrives as well.
Amazing. You are fantastic. I'm so excited to have gotten in connection with you. Again, guys, if you're in California, if you're lucky enough to be in that area around San Francisco, the whole Bay Area, Oakland, California, go visit Dr. Richter at Holistic Veterinary Care. Make him your new veterinarian. Make his clinic your new clinic. Dr. Richter, thank you so much for joining us. I know everyone was so excited for this information. It is a hot topic, as we all know, and it is super important to get the correct information out there.
Thank you.
So I'm going to hit stop. Dr. Richter, don't go anywhere.
Okay.
It'll keep us connected, but bye, Facebook.